CT scans are essential for accurate diagnosis, yet many patients hesitate because they worry about radiation exposure. In modern medicine, how justified is this concern? Welcome to GIBBEUM AI Healthcare near Gangnam in Seoul. Today, we look at how advanced technology and AI have changed radiation safety standards in CT imaging.
Radiation dose management is a critical part of radiology. Earlier generations of CT scanners were associated with higher exposure levels. Current systems are designed around the principle of ALARA, as low as reasonably achievable. With our AI-driven protocols, we can significantly reduce radiation dose while still maintaining the image quality needed for reliable diagnosis.
Doctor, every patient has a different body type. Does the machine use the same amount of radiation for everyone?
No, it does not. We use a technology called CareDose 4D, an automated tube current modulation system. It analyzes the patient's cross-sectional anatomy in real time. Technically, it lowers the radiation output for thinner areas and increases it only where necessary for thicker regions. This way, each patient receives a minimum effective dose tailored to their specific physique.
I've heard that you use something called a thin filter here. What exactly does it do?
The thin filter performs what is called spectral shaping. An X-ray beam contains high-energy photons that are useful for imaging and low-energy photons that are largely absorbed by the patient without improving the image. By replacing a thin filter in front of the X-ray source, we selectively remove those unnecessary low-energy photons. As a result, we can significantly reduce the patient's radiation exposure, especially in examinations such as lung and lung screenings, while still obtaining the diagnostically useful images.
Normally, when you lower the radiation dose, the image becomes grainy or noisy. How do you maintain diagnostic clarity in that situation?
That is where ADMIRE, which stands for Advanced Modeled Iterative Reconstruction, plays a role. It is an AI-assisted reconstruction algorithm designed for low-dose imaging. Because low-dose scans naturally contain more statistical noise, ADMIRE iteratively processes the raw data to distinguish noise from actual anatomical structures. This enables us to produce high-resolution diagnostic images even when we use very low radiation settings.
One of the most common questions from the patient is this: is it safe to undergo CT scans as part of annual health checkups?
For specific low-dose protocols, the answer is yes. For example, our low-dose chest CT uses radiation levels comparable to only a few standard chest X-rays. From a clinical perspective, the benefit of early detection for conditions such as lung cancer or coronary artery calcification greatly outweighs the minimal risk associated with this level of low-dose exposure.
Low dose, high precision. Visit us at GIBBEUM AI Healthcare near Gangnam in Seoul.
We prioritize patient safety through the use of advanced imaging technology.
Scan the QR code below to access our English booking system. Thank you.